More than 30 states are reporting a rise in coronavirus cases and hospitalizations. The CDC reports new infections in the past week increased by more than 16%. The agency also says the Delta variant makes up more than 99% of all circulating cases in the U.S. The surge comes days after federal health officials authorized booster shots for both Pfizer and Moderna's vaccines for all Americans 18 and older. So far, more than 36 million Americans have received an extra dose. For more, I want to bring in Dr. Hiral Tipirneni. She's an emergency medicine physician in Phoenix, Arizona. Doctor, welcome. Thanks very much for being with us. So the American Academy of Pediatrics and the Children's Hospital Association reports 142,000 kids tested positive for COVID-19 from November 11th to November 18th. Now, that's a 32% increase from 2 weeks prior. What is behind that surge, and should people be concerned?
Well, Elaine, thank you for having me. And yes, those numbers are worrisome. There's no doubt about it. Over the last 2 weeks, as you said, pediatric cases across the country are up to 32%, and they account for greater than 25% of all COVID cases currently, which is, certainly the peak that it's been since the beginning of the pandemic in March of 20. This is concerning, but I think we have some clear reasons for it, and I think there are clear actions that can be taken. One thing we know for sure is that this Delta variant is aggressive. We've known that for several months now, and that continues to be the case. We still have a large percentage of our communities that remain unvaccinated, and that leads to continued high levels of community spread. As you mentioned, the cases all across the board are high in many states. And then we have waning immunity. So even those folks who have been immunized, that immunity is waning, and that's why it's so important now that people are aware that booster shots are recommended for everybody 6 months post their second dose of Moderna or Pfizer, 2 months post their shot of the J&J vaccine, to make sure that they are building that strong level of immunity and staying protected while this Delta variant is still so rampant in our communities.
Well, last week, the White House said more than 10% of kids had received at least one dose of a vaccine. Doctor, what advice do you have for families celebrating the holidays with unvaccinated children?
Yeah, look, it's our job, right, to protect those that are most vulnerable around us. And whether those are children who have not received their full course of vaccines, or if they are our relatives and friends who are immunocompromised. There are a lot among us that are vulnerable, so it's important that we all do what we can. The CDC is recommending that, we still stay at fairly small numbers. We're not quite to the point where we can have just these huge gatherings of, 3 dozen people or so. I think the number everyone is recommending is to stay around 10 to 15. Obviously, knowing the vaccination status of your family members, of the people that are gathering in your home, is important. If you can, gather outdoors. Obviously, we know that being outdoors is much safer than being indoor settings. If you have to be indoors, make sure you have good ventilation, make sure you have adequate air filters, and you're going to really be recommended to wear masks indoors if you don't know either the status of everyone as far as being vaccinated, or if they're unvaccinated people in that group. So those are things that we can do to make sure that we can keep everybody around us as safe as possible over the holidays.
Well, some parts of the U.S., like the Northeast and New England, are seeing upticks in caseloads despite their high vaccination rates. Why is this?
Well, again, and that is happening here in Arizona as well. But, there are other factors at play across the country. We are getting into the winter months, which means colder temperatures, which means more people are indoors. We have people in indoor settings, maybe not, the best ventilation. Windows are probably not open. And let's face it, there's a lot of fatigue with the public health protocols. People are tired of wearing masks, and we understand that. It's not easy, but it is still the safest thing to do when you are indoors and you're around folks who are unvaccinated or outside of your family group. So this is expected to some degree. We also have to worry that it is flu season, so it's really important that we do a few things. First of all, if you're not vaccinated yet against COVID, please get your vaccine. If you are 6 months out from Moderna or booster, everybody's eligible. If you're 2 months out from your J&J, get your booster, you're eligible. And if you have children 5 to 11, remember, they are now eligible for vaccinations. So get them vaccinated, they can be fully protected by Christmas. If you're going to be indoors, you're going to probably wear masks if you're not just within your family unit. And just try to hang in there. I know it's tough, but we have to all do our part. That's the only way we're going to find our way out of this. If we want to go back to large family gatherings, we want to keep our businesses open, we want life to go back to that sense of normal, we all have to do our part. And right now, we are still not seeing the level of vaccination rates across the country that we need. And certainly here in Arizona, we are lagging behind. Just recently, there were multiple leaders of our local hospital systems that reached out to the community on a broad level and said, please, we need everybody to do their part. Our ICUs are full, ventilators are reaching max capacity, we are short on staff. We need everybody to do their part so we can take care of the people that we have in the hospital and keep the rest of the folks out and healthy.
Sobering picture you paint of the way the situation really looks on the front lines. Dr. Hiral Tipirneni, thank you very much, doctor, for sharing your insight with us.
Thank you for having me, Elaine.